the number one question that I get, what is Dapsone therapy?
So Dapsone is it's an antibiotic that's been around for a very long time, over 50 years. The reason I kind of knew to use Dapsone and thought about using it was when about 7 years ago, Johns Hopkins researchers had published that Lyme is a, quote, persister bacteria, meaning
Mhm.
not that it persists in the body per se. We knew that already. There was a lot of articles already in the journals about persistence, but that it persisted like certain other bacteria, like Mycobacterium
Mhm.
tuberculosis, Mycobacterium leprae, which persist in a very specific way in the body. And they found that it was under biofilm. So Dapsone is an antibiotic. It's been used for leprosy. So for example, rifampin and Dapsone for 1 year is generally considered a cure for leprosy. So if you have another
Mhm.
persister bacteria that causes chronic illness, leprosy, Mycobacterium leprae, they use rifampin and Dapsone for 1 year. The Dapsone dose is normally 100 milligrams per day, and people will go into remission. So I kind of came up with the idea and looking at those past studies that I wanted to get a drug that had already been used for another persister bacteria with success. So as obvious it might have seemed, as I just looked at it and went, well, if rifampin and Dapsone is curing leprosy or putting people at least in long-term remission, why don't I just add some doxycycline or minnow at a tetra and make it doxy-minnow rifampin Dapsone, a persister drug regimen, and let me see what happens. And the way this started was back in 2016. I published my first study on Dapsone. It was in 100 patients.